Good night. I'm doing a presentation today on health promotion. Question number 1. Assess and evaluate my area. The community where I live in is located in Jamaica, Queens, an urban residential area with a dense population. According to U.S. Census Bureau data, the neighborhood has over 58,000 residents and a high population density, which can place strain on housing, transportation, and healthcare access. Although the median household income is approximately $79,000, more than 14% of residents live below the poverty level, creating economic stressors that may negatively impact the mental health and access to care. Question number 2. Groups represented within a 2 to 3 mile radius. Within a 2 to 3 mile radius of this community, the population is racially, ethnically, and culturally diverse. U.S. Census data indicate large population of African Americans, Hispanics or Latinos, white and Asian residents, including many immigration and first-generation families. There is also a wide range with children, working adults, and older adults well represented. Additional information from the New York City Department of Health and Mental Hygiene shows that many households experiences economic insecurity and language barriers, which may limit access to mental health services and increase vulnerability among these groups. Question number 3. Major health problems or high-risk behavior. As a major health problem affecting individuals, families in this area is mental health disorder, particularly anxiety, depression, and stress-related conditions. The NYC Department of Health reports that approximately 11.3 of adults in Queens have unmet mental health needs, meaning they require care but they do not receive it. Additionally, the National Institute of Mental Health reports that 50% of lifetime mental illness begin at age 14 and 75% by age 24. This is especially concerning given the large number of youth and young adults living in this community. Question number 4. Health education program and rationale. To address this issue, I will propose a community health awareness and support group focused on the education, early identification, and stigma reduction. This program would include workshops on recognizing symptoms of anxiety and depression, stress management strategies, coping skills, and information accessing local health resources. Free screening opportunities and peer support discussions would also be offered. This program is necessary based on 2 key points. First, 11.3% of adults in Queens report unmet mental health needs, and the second half of all mental health disorders begin before the age of 14. Addressing these issues early through community education can prevent symptoms from escalating and improve long-term outcomes. Number 5, location and attraction. The program could be held at Jamaica YMCA, a centrally located and trusted community space. This location is accessible by public transportation, familiar to residents, and already serves families, youths, and older adults. Holding the program in a non-clinical, welcoming environment may reduce stigma and increase participation among individuals who might otherwise avoid mental health services. Question number 6, day and time. The program would be most effective if it is offered on a Saturday from 2 p.m. to 4 p.m. This allows times for working adults and families to attend without conflicting with the weekday responsibilities. Weekend afternoon sessions are especially important for this population, as many residents work extended or non-traditional hours, making weekday attendance very difficult. Question number 7, nurses' education skills and knowledge. The nurse educator must demonstrate a strong interpersonal skill and knowledge, including cultural competence, empathy, active listening, motivational interviewing, trauma-informed care, health literacy assessment, and familiarity with local mental health resources. These skills are essential for building trust, encouraging participation, and motivating individuals to seek care. Question number 8, community partnership. A strong community partnership would be NAMI, N-A-M-I, Queens/Nassau, an organization dedicated to mental health education and support. NAMI can contribute trained facilitators, educational materials, and peer support resources. This partnership enhances program credibility and ensures participation have access to ongoing support and referrals beyond the program itself. Question number 9, real-world potential for success. While this program has a strong potential, challenges such as mental health stigma, inconsistent attendance, and limited funding may impact the outcome. However, offering the program in a trusted community location and partnering with established organizations increase the likelihood of success. With constant outreach and cultural sensitivity education, this program can realistically improve awareness and access to mental health care. Question number 10, closing and summary and recommendation. In conclusion, 3 key points that stand out. This community has a significant mental health need. Early education and intervention are critical, and community-based programs reduce stigma and barriers to care. Based on these findings, I recommend implementing this mental health education program on a recurring basis to strengthen mental health awareness and improve the overall community well-being. Thank you.